I've been a GP since 2015. In other countries, GPs are known as family medicine. I worked in the UK for a while. I went to the Middle East, setting up a primary care centre. I came back to the UK just before COVID hit, and since then I've been working in a lot of it's in urgent care, but I've also begun to support health technology companies to access the UK market, to get products that are very useful for healthcare, but often finding a difficult path to actually getting into frontline care.
Want to attract and convert more leads? Want to learn how digital PR, branding, and SEO can establish and build your brand identity? Welcome to the Market Movers Building Brands and Links with Linkify podcast. We answer these questions and help you ramp up your brand visibility and credibility. Let's cut through the noise and make your business the talk of the town. We're your hosts, Nick and Chris. Let's get this show on the road.
Welcome to the Market Movers podcast. Today's guest is Dr. Junaid Hussain, a UK GP and digital health strategist who advises health techs through Health Collider, PractiKey, and his own consultancy focused on clinical safety, governance, and market entry. Welcome to the show.
Very much. Thanks for having me, Chris and Nick.
Junaid, thanks for coming on. To start, why don't you tell us a bit about what you guys do and who you help?
So I suppose starting with myself, I'm Junaid. I'm a GP by background. I've been a GP since 2015. In other countries, GPs are known as family medicine, doctors of family medicine, consultants. I worked in the UK for a while. I went to the Middle East for about three and a half years. I worked there setting up a primary care centre. I came back to the UK just before COVID hit, and since then I've been working in a lot of it's in urgent care, but I've also begun to work or start implementing some of the things I've been learning over the years to help support health technology companies to access the UK market, to get products that are very useful for healthcare, but often finding a difficult path to actually getting into frontline care. So making that path easier for them, for both sides really, for primary care providers primarily, to be able to find the right type of tools that are useful for them, and for the companies to find the right type of practice for them, whether it's to do a pilot, to do some research, or whether it's to be bought so people can buy their products. And one of the means by which I do that is through Health Collider, which is the company that I set up with a couple of my colleagues. That spun out of a WhatsApp community that I run that has over 800 UK doctors, all with a focus on discussing healthcare technology, healthcare innovation as well.
Wow, what a cool way to start a company, just from an organic WhatsApp group.
Yeah. So even that group is pretty crazy. I just put a post out on LinkedIn saying, hey, is anybody interested in talking about health technology? Any doctors out there? It was a very selfish reason for setting it up. I was just like, I wanted to speak to people who had very similar views to me. I didn't even want to I didn't think of it in any complicated way. And I had a massive influx of doctors who had a lot of interest in that group community, and it's grown massively since. So 800 doctors at the moment, just over 800, and yeah, it's really fantastic conversations. We've got doctors who are now ex-doctors, who are startup founders, some are software engineers, some are run-of-the-mill, you can say, GPs or consultants and so on, but all learning from each other. Yeah, and from that, because they're all like very tech focused or innovation focused rather, then from that spun, they're the ones who really want to grab onto new things, try them out, play with the latest Apple Watch, that type of stuff. So it's that type of people. And then when you've got cool new ideas and new technology coming, those two things sort of come together quite nicely.
Is that a community that you manage? Is that something you're like actively working on and growing, or is it just something that's out there that just lives on its own?
It's live every single day. So there's conversations in it every single day. We have many subgroups. So there's a general group with general conversations, but then there's subgroups around AI, primary care, psychiatry, talking about various facets of innovation. So people think about healthcare innovation, they think about, technology, AI, those sorts of things. But it could just be simply things like rejigging the way pathways work, rejigging the way the patient journey works. And that can be quite innovative. It can change drastically the way things work for patients for the better, or sometimes for the worse. It's so it's around that, but it's taken a life of its own. I don't need to be as hands-on the conversations are very organic in there. Sometimes there's a lull for a few days. Sometimes then it's, I wake up with like 120 messages of people been talking back and forth.
Well, that's awesome. Okay, so before we dive into this, I think it would be good to get a lay of the land of the current UK health industry, should we say? As a type 1 diabetic user, I use the NHS frequently, and I won't say it's okay. There's
You can be we're all friends here.
Yeah, we are all friends. Well, I'll leave it to you. We had a little conversation before we came on air, and you misspokenly said that all doctors were looking to leave. But I mean, that is a sense that you get when you're dealing with the NHS. Tell us what's going on, and why do you think people are looking to get out?
So it feels like we're forever saying that NHS is going through a hard time, but it is going through a hard time. And from the clinician's perspective, doctor's perspective, it is because there's a lack of work, believe it or not, even though there's a need for doctors. So you'd find that, for example, the last time I read, half of junior doctors after the first couple of years try and get into a training post. They're not able to find a training post. So there's a bottleneck. There's half of them are there thinking, we're going to be redundant, we're going to get a P45. So they end up thinking about lateral things like either moving abroad, going to Australia, to Canada or somewhere else, or they think, you know what, I need to have a side hustle and a business, something to fall back on in case the NHS, which was previously seen as, a very stable job, very clear pathway, that falls through. It's the same, believe it or not, with GPs. I remember a while back some politicians joking about how GPs, they're probably playing golf. They've got lots of time on their hands. There's hardly any work available for GPs at the moment. And there's GPs who have jobs, have got the steady job, but should they lose a job for any particular reason, there's barely any work to get back on the ladder. So never mind those who just finished training. So again, doctors are looking at tangential ways of supplementing their income or putting plans in place like anybody would do in any industry, any career. You wouldn't just sit there and say, I hope one day a job opens up. You're going to start looking at other opportunities. From those are those who go abroad. From those are those who start looking at online and saying, well, we've got those TikTok doctors, for example. You've got those who are very prominent on social media in different ways. You've got those who open up their own private clinics. You've got, there's different ways that they go about doing it. And fair play to them. I think, it just like it is to anybody in any industry. If you're struggling to find work, they're not sat on their hands not doing anything. They're actually proactively looking online for different types of work. So in terms of the NHS, from that perspective, from a work perspective, yeah, that's sort of what it is at the moment. In terms of how things are run, in terms of management, in terms of pathways, in terms of how you, for example, get to see your doctor, your GP, how you get to see your specialist, that's a whole different conversation because there's a lot to unpack there. Suffice to say that things can probably be done in different ways and possibly better. But remember as well, people, when we think of the NHS, we think of one, the NHS logo, and we see the NHS logo everywhere. We think it's one organisation. But you're talking about 100-something plus trusts. You're talking about each primary care practice being its own small business. So it's not as simple as you're talking about thousands of NHSs rather than one NHS with some dictated rules from the top. But otherwise, trusts have their own internal policies, how they manage their locality. How that works out, unfortunately, can be a bit of a postcode lottery.
Is there do you have private clinics and hospitals? Is that not like a viable option for doctors to transition to?
Absolutely, there is, and there's a growing sense that that's the direction in which things are heading in the UK. Many patients are struggling to wait for long waits in the NHS for, let's say, hip pain or whatever condition that they may have. So they'll save some money and try and go privately. So yeah, and that's generally the direction I think a lot of things are heading, and doctors are looking at that actively. I have to say it's crossed my mind as well. That has its own several steps involved as well. You have to get registered with CQC, and that can cost a bit of money. It's whether you want to have a purely online presence or do you want to have a physical building, and how do you differentiate yourself from other private clinics and so on. But you are seeing a trend of doctors who are now setting up their own private clinics.
I think it's really interesting, and it seems like an obvious thing, especially the doctors that are interested in technology and like improving things at a quicker pace, because the NHS is slow moving, it's bulky, I had to update an address for a prescription the other day, which I did on the Patient Access app, which is an app that we have access to in the UK, which updated my address with my GP. I then had to go to the hospital and update my address at the hospital separately on a separate system. And then my prescription still went to the wrong address because there was a third system that I was unaware of that it had to be updated on. So it seems like it seems rife for people wanting to exodus that for a more fast-paced and innovative type of business endeavor. So these guys that are going out, how are they getting started? How are they getting themselves out there? You mentioned TikTok. How are they leaving a stable salary and starting these new tech businesses and driving interest?
Yeah. So I think a lot of it is they're realizing they're having to put themselves out there, myself included. I'm not someone who likes to see myself on camera. I don't like to hear my own voice. I think it's true for most of the world. We don't like to look at ourselves in that way, but I think we're swallowing our pride to some extent and saying, you know what, it has to be done. And you're right, it's difficult sometimes to change things within a healthcare system where you're persistently having to ask for permission from others to do very simple things or change simple things. I mean, and that can feel very bureaucratic. I don't blame necessarily the system, but I think it is, a lot of doctors are getting frustrated with that, and patients are as well. And like you said, it shouldn't have to go to 3 separate places just to update your address. It should be more joined up. So doctors are looking at different platforms. You mean this well-known famous doctor, Dr. Karen Rajan, who does he's a colorectal, I think, a surgical specialist, who talks about healthcare. He's well known on TikTok. You've got others who are smaller, some who are junior doctors. I wouldn't call myself an influencer in any way, but I tend to be relatively well known on LinkedIn, and that's where I started. I started really moaning. It wasn't anything coordinated to begin with. It was just moaning about how I'm not happy with certain bits of technology, but it grew into and ways things worked, but it grew into something a bit more tangible than that with time. So yeah, the difficulty for doctors is that they've never been trained necessarily in business or in marketing, so they're all having to feel out this sort of area, get out of the comfort zone, try to figure out which is the best platform for me. Do I create a website and focus on SEO? Do I go to Twitter and talk on there? Do I use TikTok and do lots of videos? Do I a lot of people are doing, make a podcast, repurpose everything and stick it on YouTube and elsewhere, or a combination thereof. And so it's interesting to watch from my perspective. But I know you guys can probably tell me, but I don't think there's one way that it can be done. And it depends on your ultimate goals. For me, a lot of my work is with governmental organizations or with private businesses. And for me, LinkedIn is the best platform. I can't imagine my clientele come from TikTok, but you never know. Yeah.
Well, let's break down that strategy a bit more, because when I think about like a doctor opening their own clinic, trying to find new business, I think about Google, Google business profile. They're looking for people in their local area who are searching for that doctor. When you look at building a brand, going onto a specific platform, you've got people all over the world. How do you translate that into finding local clients who are going to come into your office?
You have to meet people where they are, your client where they are. So where someone is very likely to be on TikTok for their health information, you have to be there providing them with the correct health information and the correct guidance. And you can be creative about that. You can be funny about it. You can create cartoons. You can be whatever people do on TikTok and various platforms. In my case, with health technology, most of my clients are on LinkedIn. So it makes more sense for me to do it in that way. For some, as you said, it's a combination thereof. And I think clinics, you're right. Some of my colleagues, I have a colleague, for example, in South Manchester who has an ADHD clinic. All his clients are local through Google SEO. He just put his clinic on there, mentioned it's about ADHD, and overwhelming majority of his clients have come from his local area, and that's more than enough to run and grow his business. And he doesn't need to go to TikTok, doesn't need to dance and do these sorts of things to get clients. But others may find that a suitable strategy. I mean, they might find that people. I have ADHD. People with ADHD will, we want the dopamine hit. We will be addicted to scrolling on screens. If that's where you find your client, that's where you put your content out.
Do you think that as more and more people leave the NHS and try to go private, we've actually interviewed a couple of doctors over recent months who have gone private. As this potentially becomes more of a competitive landscape, do you feel that, for example, your colleague with the ADHD centre in Manchester, he could face some competition in the coming years, and therefore he's going to be competing. Google may not be enough to separate him and drive the sort of business he wants. Do you think personal brand and building a personal brand is going to play a big factor as we start to see competition increase in this space?
Absolutely. For every other clinic at the moment appears to be an ADHD clinic as well. You're right, absolutely. Even with opening up an online business at Google and you're advertising on Google, when you go to the website, what do? You look at the doctor's name, you click on the doctor's image, you see what their background is. That's the personal brand. That is, you want to know which university they went to, how much can you trust what they said, how much experience do they have, what the testimonials showing. You want to get to know them a bit more. Sometimes you might Google their name in YouTube to see, are there any videos of them? What are they saying? How are they as a person, individual? How can I relate to them? And so we tend to, as customers, I suppose, have a lot of touch points that we look at. I mean, I very rarely buy anything except that I'm looking at several different places, Googling their name, checking Trustpilot for reviews and so on. So when it comes to an individual, yeah, absolutely. People want to know who you are, want to be able to trust you, want to be able to understand your tone of voice, the way you speak, how honest they feel you are, and so on. And I've found that through LinkedIn, my clients often aren't the ones who like my posts. They're the ones who have just seen me and years later come and said, "Oh, I've been following you for so long, and I really appreciate you this, and I want to get involved with that," and so on. So yeah, absolutely, it builds trust and it builds depth to your offering for sure. And we all leave a footprint online, so it's down to every doctor to decide how they want to leave their footprint online. But ultimately, patients in particular want to know the doctor who's going to be looking after them. Even on the so-called free NHS, it's not free, we get taxed for it, but even on the NHS, we still feel, I don't want to go with Dr. X, he treats me like that, I want to go to Dr. Y because I like them more, because they understand me better. That's it's not a personal brand, but it's a mini, tiny version of a personal brand. Every doctor sends out an image, whether they like to or not, and you can curate that to some extent or another as well.
I think a couple good points there. One, like you should have a really good bio. Like there's things people look for, like holistic or whatever it is. They might have some sort of like, I lean towards this type of treatment, or I want someone who's sympathetic. Other people are like, I want to be in and out. Someone who's just straight to the point, gets me on the road. So I think like really putting your personality or experience in that bio is a no-brainer. You also mentioned on LinkedIn how this is something we've heard a lot of people say, that it's never the people, or rarely the people who are actually commenting and interacting with your post who become your clients later. It's the people who just see you. And I think a lot of people, when they give the reasons for, well, I'm not going to spend time on LinkedIn, it's because whenever I put something out there, it's just irrelevant people who are commenting on it. They're clearly doing it just for engagement. And so that's always something really important to remember, that it doesn't really matter who's commenting. That just gets more exposure. Your ideal prospects are out there and they're watching. And then whenever they're ready to find a new practitioner, they'll have you in mind. So a couple of good points there.
I also think it's really interesting as well, the point that you made about it could be months or years later. And it's that multi-touch point and that back of mind as well. So somebody may have seen something that you'd written on LinkedIn with a child undiagnosed with ADHD, and then years later they get diagnosed with ADHD and they think, well, I have someone on my LinkedIn feed who's always talking about this, and that's the person I'm going to go to first. So you can be planting seeds for weeks, months, years ahead of time, which I think is awesome. Okay, I suppose as we come towards the end of this, this has been fascinating, by the way. It would be remiss of us to not discuss AI. Are doctors going to become irrelevant and everyone can just ChatGPT their problems and it diagnoses our issues? And when will AI cure type 1 diabetes as well? That's another one.
I'll make sure to answer that one at the end as well. There's a lot being said about this. So if you ask the people who've invented the AI techniques or who run the businesses, they'll say, yeah, doctors are going to be replaced in 5 years' time, 10 years' time. You see it all the time on LinkedIn. Bill Gates said this, the CEO of ChatGPT said that. They run that business. Unless they said that, there wouldn't be having as many shareholders, so they need to sell their business. The reality is that AI will augment doctors. They'll help them. It'll give them extra ability to do things more efficiently. As a result, hypothetically speaking, you may need less doctors to do the same amount of work, but no doctors? No, I don't think so. I think the area is too complex, unless you get to a stage where the government gives indemnity to AI holders, saying it's okay if you make a mistake, we will cover you. Otherwise, I can't imagine happening anytime soon. That's an ethical argument there as well. Will if the government indemnifies AI and say, you're okay to make a mistake very occasionally, and we'll cover you, otherwise you're fine, then that's a different story. I don't see it happening. I see doctors being augmented and being supercharged. But I don't see them being replaced in that respect, or many industries necessarily. The will AI cure diabetes? Type 1 diabetes in particular. I'm funnily enough, I'm optimistic that there is a whole space in around AI and drug development and genetics and so on. Type 1 diabetes is an incredibly complex condition, multifactorial, and it's will it happen in the next 5-10 years? I'd say realistically probably not, but I think that a big progress can be made in both understanding how it's treated and possibly having um, longer term solutions other than
Solutions, yeah.
here's just a better insulin for you. Although that might be an equally good outcome, but yeah. So there is a lot of scope. There's a whole plethora of development in technology around new types of drugs being found through AI, new types of mechanisms being found through AI. It's only as good as just like with most AI, it's only as good as how good the prompts are. So as the ability of those experts to use the technology gets better, then definitely the use cases will improve, and I'm optimistic. I hope so. I think diabetes, amongst other conditions, I hope so, because it's certainly a challenging condition and has a lot of a lot of difficulties with it for many of the patients who have it.
That's definitely like a great use case, and we're all hopeful that it comes up with lots of cures there. I want to go back real quick to the thing you said before. I think it's a common narrative that in most industries that AI is not going to replace everyone in the industry, but it's going to replace some. It's going to give the ones who really lean into it and embrace it will probably pick up more market share. For doctors thinking about this, how should they be implementing AI, or maybe preparing to implement? Maybe some of the things aren't there yet, but if you want to be one of those doctors that grows your practice with AI, what should you be doing now?
So there's no one beaten path at the moment because it's such a new territory still. I think there are courses available online. Some of them, I remember the Royal College of Surgeons, for example, have recently had a course on AI to upskill clinicians. I think if you're struggling with the basics of understanding how AI works, it's really important to use those online courses to understand it. You don't need to spend days and weeks to do it. Just a little bit of learning would go a long way. It's difficult to know exactly how clinicians, because there's no one way that they can use the AI, except to understand the underlying principles that it will help you to make better decisions and to be aware of the tools, because there's a lot of tools out there which are in development right now, not necessarily licensed. That's a different conversation, but there are tools that are in development. Watch the space for tools that will help clinicians to make decisions better. To clinicians put the information in, and they'll tell them which guidelines are best for them to use, what the most appropriate treatment strategy probably would be for that patient. But remember, that's all based on the current information, and but people don't fit into boxes, and clinicians will still have to use their own judgment. Even now, in my own practice, the guidelines available that I can access, I still have to reject those guidelines from time to time and use my own knowledge, because the patient doesn't fit into it. But there's no one hard rule for that, Nick. There's a matter of exploring and trying to understand the bits that are available, but also understand the limitations of the technology. Understand that if it's not regulated, that it could be very risky, and you carry the risk as a clinician. So there are loads of tools out there, like the common one's mental health. Every other tool, in the wellness space, is about mental health. Not all of them are safe. Not all of them are are regulated. As a result, if that hallucinates and gives you the wrong information or says, you know what, I don't think there is a better way out for you today in the world. I think, your situation is terrible. It's like that, but these tools do unfortunately do hallucinate in that way. So you have to be very, very careful, both as patients and as doctors.
What about from a business operations perspective? So we've got the two competing ADH clinics in Manchester. One isn't implementing AI in any way, and the other one has got AI automations to manage patient appointments. And is that something which you think they should be seriously considering to start to implement, or you still think, is there still an issue with rules and regulations when it comes to that sort of thing?
Healthcare is always guarded by rules and regulations, and you have to understand that there is risk to even using agentic AI. So use the AI as a receptionist, for example, to do some of the quote unquote admin work. But saying that, you can save a lot of money as a practice by using the right AI tools for whatever use cases that you need them for. So, for example, if it's to help, say for example you need 3 receptionists normally, but actually, you might need one less because you're using AI to help cover a lot of the work and a lot of the email writing or whatever it is that it does automatically for you. That saves a lot of time. That saves essentially money as a bottom line. So the practices can use multiple. I need to consider that. I'd definitely say those practices that use AI will have, or even begin to start using AI and playing about with it. It's most of the AI tools are on a subscription basis as well, so you can always cut it off after a month or two. But playing about with those, you'll find that over some months you're starting to notice some efficiency benefits. And when that efficiency benefit translates into you needing less people, usually less people, so you're replacing people to an extent with AI, then that's when you start to see cost savings coming into your practice. The other thing is getting the patient from A to Z quicker and more efficiently. Again, that comes with AI. So booking the patient effectively, follow up effectively, emails done effectively without losing patients to follow up, making sure that, it's good for clinic retention. It's also good for patient safety, which is more important, and patient well-being, that they're happy with that they're being looked after.
Perfect. Let's wrap up with your prediction. Let's say, I like to ask long term. I think 5 years right now is more long term with the way things are, the speed of progression. What do you think the healthcare space looks like in the UK in the next 5 years? Does AI have a major disruption, or is it more minor?
Very difficult question with the UK, because there's a lot of there's always ambition, but it's sadly. I'm gonna be pessimistic on this one. I don't see there being that as big a disruption as I'd like it to be. I think because of the structure of healthcare in the UK being so many different organizations, and as you said, going from one organization to another just to change address, I can't see that being changed massively in the next 5 years. I think you'll find your appointments are probably being made more efficiently. I think access to doctors is still going to be an issue in 5 years' time. I think quality of care, and it might be new drug discoveries, but translating that into getting to the patient, I think that's not going to happen that quickly in 5 years. So even by 2030, I could be wrong on this. I'm going to watch this podcast in 5 years' time and set my alarm for 5 years. But yeah, I think AI will make some disruption. I think you'll find disruption will be better in countries that lean into more accepting that there's some risk to AI, but being more ambitious with how they use it. In the UK, we tend to have a fear culture around new technology. We tend to panic over, oh my God, if I implement AI, someone could get really badly hurt, rather than thinking people are already getting badly hurt and they might get less badly hurt, even though they might get hurt still. And see what I mean? Again, it's an ethical argument here. How much risk are we willing to accept as a society, and how much are we willing to accept that the risk that there is present in the system at the moment?
This has been awesome. Final question, because I need to know the answer to this. Why, when the NHS is struggling for staff, is there no jobs for doctors? What's the logic behind that?
So there's bottlenecks in training, so not enough training posts, and even those training posts don't transfer into consultant posts or GP jobs, so a lack of GP jobs available. The funding that was initially so a lot of GPs at one point were locum GPs, so they fill in jobs where there was someone was sick at the practice and so on, so they travel around here, then everywhere. Those positions went because of a change in the funding. Alongside that, physicians associates have come in, not to blame them in any way. They're very, very valuable. But physician associates were trained. They took 2 years of training rather than the 5 years of medical school. And they are able to pick up some of the work that GPs did, for example. And they're meant to be supervised by other GPs. So then they were essentially a cheaper alternative to some extent. So there's a combination of different factors in there. How safe all these implementations and all these changes were, that's a different conversation. But there's a lack of work, bottlenecks in training, bottlenecks in getting jobs after training, and then also new systems being implemented that pushes doctors out of what would ordinarily have been their work.
Okay, that's fascinating. Final fire question. Set an alarm for 2035. Will we still have an NHS in 2035? Can be yes or no.
That is a question. That is a question. I'd say yes, but I think it'd be very much like NHS dentistry.
Okay, so it's going to look very different.
Minimal, I think. Minimal emergency stuff, and the rest of it will be private. That's my instinct, but I could be wrong. 2 alarms, setting them now.
Well, Junaid, it's been absolutely fantastic having you on. If people want to track you down and find you, where can they go?
So my LinkedIn, Dr. Junaid Hussain, pop that into LinkedIn. I have my own personal website, drjunaidhussain.com. It's nothing too complicated. Healthcollider.com as well for work around Health Collider, health technology. But please say hello on LinkedIn or drop me an email anytime.
That's awesome. Thank you so much. You've been a great guest.
Thank you, Nick. Thanks so much.